All right, today we are diving deep into kidney stones. Specifically, we're going to talk about the imaging tests doctors use to figure out what's going on. The whole idea here is to pull back the curtain on the process, so if you're ever in this spot, you feel a little more prepared and a lot less worried. Let's get into it. You know the feeling. It just hits you. A sudden, really sharp pain that seems to come from absolutely nowhere. And your first thought is, what in the world is happening inside my body? It's a scary moment for sure, and it's what sends most people looking for answers. And you know what? That alarm bell going off in your head is totally understandable. But for doctors, these really intense symptoms, they're actually the very first clues. Before they can even think about looking inside, they start by checking for the classic telltale signs of a kidney stone. So, if you're dealing with any of these, let me just say, you are not imagining things. That intense pain in your back or side, maybe seeing a bit of blood when you go to the bathroom, or just feeling pain when you try. These are the big three symptoms that make a doctor immediately think, okay, we could be looking at a kidney stone. So once the symptoms are pointing in that direction, how do doctors actually confirm it? They can't just take a guess, right? This is where medical technology is pretty amazing. They use different kinds of imaging to get a crystal clear picture of exactly what's going on with your kidneys and urinary tract. The first, and honestly the most common tool they'll reach for, is an ultrasound. You might also hear it called a sonography. All it is using sound waves to create a little map of your organs. But the most important part here, no radiation, none. That makes it an incredibly safe first step, and it's why it's the go-to for kids or for women who are pregnant. But an ultrasound isn't the only tool in the toolbox, and it's not always the final word on the matter. Depending on what's going on with you specifically, your doctor actually has a few different options to choose from, and each one has its own set of strengths. And here are the three main players: ultrasound, X-ray, and the CT scan. As you can see, everything has its pros and cons. Ultrasound is super safe, but, it might miss some of the really tiny stones. An X-ray is quick and doesn't cost a lot, but some types of stones just don't show up on it. And then you have the CT scan, which is incredibly accurate, but it does involve more radiation and a higher cost. And this chart, wow, it just shows you the difference so clearly. Look at that. A CT scan is over 95% accurate. That's why it's often called the gold standard for diagnosis. It can spot stones that are as small as a single millimeter. An ultrasound is still really good, don't get me wrong, but you can see the huge leap in diagnostic power. Now, let's flip it and look at the other side of the coin, safety. This chart makes it totally obvious why doctors almost always start with an ultrasound. I mean, look at that, 0 radiation. It doesn't get any safer. Even an X-ray is pretty minimal. But for that complete peace of mind, ultrasound is the undisputed champion. And of course, we have to talk about cost. An X-ray is generally the most budget-friendly option. Meanwhile, that CT scan, the one that gives you that unbelievable level of detail we just talked about, that's going to be the most expensive. So it's always this balancing act between getting the most detail, staying safe, and considering the cost.
Okay, so the scan is done. Now what? Well, the next step is taking those black and white pictures and turning them into a clear diagnosis. Let's take a look at what the experts are actually looking for in your results.
The good news is you're not expected to read these images yourself. An experienced radiologist, that's a doctor who specializes in this stuff, will go over them very carefully. They're basically on a mission to find 3 key pieces of information: the stone size, its exact location, and any clues about what kind of stone it is. Let's talk size first. If the report comes back and says your stone is less than 5 millimeters, that's usually pretty good news. Stones this small have a really high chance of passing all on their own, just with lots of water and some careful monitoring. But if that stone is larger than 10 millimeters, we're talking a centimeter or bigger, well, that's a whole different ballgame. A stone that large is almost certainly not going to pass by itself. It's almost guaranteed to need some kind of medical intervention or a procedure to get it out. Now this, right here, this is fascinating because it explains so much about the pain. It turns out location is everything. A stone can literally sit inside your kidney for years and be completely silent. You'd never even know it was there. But the second it moves into the ureter, that tiny tube connecting your kidney to your bladder, it creates a blockage, and that's what causes that unforgettable, severe pain. So all this information, the size, the location, the density, it's not just for kicks. This is the critical data your doctor needs to build a really precise and effective treatment plan. This is what lays out your path forward. So here's the journey step by step. It all starts with that imaging test. Then it's analyzed by the radiologist, and finally, those results are used by your specialist, usually a urologist, to create a treatment plan that is built just for you and your specific situation.
And that plan? It's typically going to fall into one of two main buckets. If the images show a small stone that isn't causing a major blockage, the path is what's called watchful waiting, basically managing it with fluids and pain meds. But if those images show a big stone or a serious blockage, then the path leads towards some kind of surgical intervention.
And when you boil it all down, it comes back to this one core idea. Getting the diagnosis right from the very beginning is everything. Accurate imaging isn't just another test. It's the foundation that the rest of your care is built on. It's what makes sure you get the best treatment possible.
So we'll just leave you with this final thought to chew on. We know that if you've had one kidney stone, your risk of having another one goes way up. So the question becomes, could a simple, proactive scan, like a regular ultrasound, catch a new stone when it's still small and silent before it ever gets a chance to become one of those painful, middle-of-the-night emergencies? It's definitely something to think about.